This week on Healthy Living, we look at prostate cancer and how it affects African men. And an organization provides free cancer screening in Nigeria to help curb the incidence of the disease. Plus, in the DRC, UNFPA has enlisted the help of traditional and religious leaders to fight gender-based violence. We'll have these stories and more in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Linor Moudou. The prostate is a gland found only in males. It makes some of the fluid that is part of semen. The American Cancer Society says prostate cancer begins when cells in the prostate gland start to grow out of control. And some prostate cancers grow and spread quickly, but most grow slowly. According to the International Research on Cancer, more than 1.4 million people were diagnosed with prostate cancer in 2020, and over 375,000 lost their lives to the disease. It is the second most diagnosed cancer and the fifth leading cause of cancer deaths among men worldwide. Researchers found that the mortality rates of prostate cancer across sub-Saharan Africa is 2.7 times higher than global averages in 2021. They say several factors might affect a man's risk of getting prostate cancer, including being over the age of 50. Additionally, prostate cancer develops more often in men of African ancestry than in men of other races. A family history is a contributing factor, but most prostate cancers occur in men without a family history, according to the American Cancer Society. Let's go to Nigeria, where a walk for men was held recently in Lagos to raise awareness about prostate cancer and provide free screening. Venus Alexandre has more.
Prostate cancer is a disease affecting men. There is a recommended screening process that can help detect the cancer early to increase the likelihood of survival. Nigeria's Dozie Mobwasi Foundation hosted the 5-kilometer walk with buses equipped with medical professionals doing free prostate exams. The man behind the prostate cancer screening in Nigeria is personally aware of the struggle that the average Nigerians or African men might face.
So my father, a couple of years ago, I think 6 years ago, went to do he went for a regular check, and then we discovered this issue, and then we went on straight to begin to deal with it. Of course, because we have the resources to do that. He's currently here in London. Of course, not everyone can be treated privately here in London. So we are making sure that we're able to give whatever that is available here in London, to men in Nigeria.
Traditionally, in Nigeria, most initiatives for cancer have been directed towards female cancers, and men are reluctant to get screening.
This is my first time of doing such a screening. I've not done it before. And everything was intact. And they told me they will send the results to my email. But I'm okay.
According to medical experts, when it is diagnosed early, prostate cancer is treatable with minimal or no side effect. The buses are equipped with everything medical professionals need to carry out the free screening, but Dozie wanted to go beyond just diagnostics.
We have just completed a proper hospital somewhere in Lagos where we can always refer those for treatment to. I'm sure at some point you can have access. We're happy to give you exclusive access into that hospital. We will expect to have that ready in December, fully ready in December of this year.
According to medical country of origin information, 1 in 4 black men will be diagnosed with prostate cancer in their lifetime. At least 5,000 men die due to prostate cancer every year in Nigeria.
We asked some people what they thought about prostate cancer and when to get a screening test. Here are some reactions from Lagos, Nigeria and Kigali, Rwanda.
I'm indeed scared of prostate cancer because I'm a candidate to catching prostate cancer at the age of 53. However, given the economy we're living in Africa, the priority is always upkeep, food and the like. So testing for diseases may be a secondary issue, to tell you the truth. So because it's not cheap, testing for prostate cancer competes with our standards of living, yet the cost of living.
I have heard about prostate cancer. Although it normally affects people who are old, above 50 years, but also those who are in my age bracket. Yes, the disease scares me a lot because there is a certain period where it reaches, a certain stage where it reaches, and I can no longer have children.
And since we've started this service, we've actually had several people, that have been positively diagnosed, at an early stage. Detecting this early is key, at the stage where it can be treated and they can live a very healthy and fruitful life.
At over 50, I've never for once do any screening for any cancerous thing. So this is an opportunity for me to get tested, and I think I feel cool and I feel okay with the whole exercise. I love the fact that I could check some things about my system.
Dr. Mark Hagenimana is Acting Director of Cancer's Diseases Unit in Rwanda Biomedical Center. He discusses the challenges and opportunities in addressing prostate cancer in Africa.
Prostate cancer is more common in men who are over 50 years. African compared to American, people from Europe, African are having more prostate cancer. And then it have been observed that people who are working in industries, especially chemical industries, they have a high risk of prostate cancer. Most of people that we are receiving in our tertiary hospitals, they are arriving at a late stage when the disease is metastatic, when treatment is not possible. Our treatment modalities are limited. So in Rwanda, we have a few urologists specialized in surgery. We have very few, and you are receiving a high number of patients compared to the capacity of human resources that you have. And also radiotherapy. It is good that in Rwanda you have radiotherapy that is used to treat most of the cases. But looking at the heavy workload of patients that you have, some people are not able to get treatment timely. What we are doing as a government of Rwanda, as a Ministry of Health, to address those challenges. First of all, we're working hardly to increase awareness of population about prostate cancer so that they can come early. Secondly, we are improving health facility capacity to be able to diagnose prostate cancer early.
In Nampula, Mozambique, urologist Osmani Leon warns of the need to prevent and eliminate taboos that prevent men from going from prostate cancer screening. He says that currently prostate cancer is among the main cancers that leads to the death of men 40 years of age and older in the country.
According to health specialists in Mozambique, prostate cancer is among the most common and is one of the main causes of death from cancer in men over 40 years of age. One of the health sector's bets to control the disease is screening and treatment in cases of diagnosis, but few men go to the health unit to do the exams due to lack of information, fear, shame, and taboos.
Many men are actually afraid. I don't know if it's a myth or real cases, but many have this fear.
This disease is said to attack people with advanced age. For example, from 55 years onward, these people are always affected. But in my case, I never went to the health center to do any analysis ever. When it's not symptomatic, it's not possible to go to the clinic. It's only possible when the disease is symptomatic that you can go to the health unit.
Over the past month, several mobilization campaigns were carried out for adherence to screening exams. And here in Nampula, at one such event, only 300 men came to the hospital, 5 of whom were diagnosed, says the urologist assigned to the Central Hospital of Nampula, Osmani Leon.
There are taboos of men that say, I'm a man, I can't do the rectal exam. And then he gets a disease, prostate cancer, and says, doctor, I want to live. And the doctor cannot do anything else because the cancer was diagnosed at a late stage, an advanced period of the disease, and it is very difficult.
According to Osmani, health professionals are concerned about the fact that most patients go to the hospital at an advanced stage of the disease, which makes it difficult to tackle it. Doctors such as Osmani ask men to get their health checkups regularly.
Every man over the age of 40 should have a prostate exam at least once a year. This doesn't take away your masculinity, but it has a great benefit because you won't end up with cancer. What we are looking for in medicine is prevention. The medicine of the future, preventive medicine.
The 16 days of activism against gender-based violence kicked off on November 25th and ends on December 10th. It is a global campaign to call for the prevention and elimination of violence against women and girls. UN data show that over the course of their lives, 1 in 3 women will face some form of gender-based violence. In the Democratic Republic of Congo, women represent about 51% of the population, according to UNFPA, and gender inequalities are particularly observed in economic, political, social, and cultural settings, with a direct impact on gender-based violence. Dr. Eugene Konwi is UNFPA representative in the DRC. He tells us more.
Gender-based violence is cuts across both the rural area and the urban area. It cuts across also levels of education because it is grounded in tradition. The religious and traditional leaders drafted the Lubumba Declaration to end gender-based violence, and all of them, they signed the declaration. They develop concrete actions that they are going to take in order to ensure that their declaration is implemented. Gender-based violence as a weapon of war still happens, but the government is aware of this. And last year, the president of the Democratic Republic of Congo created a national fund for the reparation of conflict-related gender-based violence, and also created a national commission for transitional justice to bring justice to the victims of conflict-related gender-based violence. We're working with the Ministry of Gender, and there's a database, but the database just shows the tip of the iceberg, because there are many cases of gender-based violence that do not actually come forward, because women, they face stigma, they fear retaliation. Men need to also protect the women. That is why UNFPA engaged boys and men in the process, because they are the cause and the solution of gender-based violence.
Monkeypox has a new name, Mpox. The World Health Organization is recommending Mpox as the new name of the viral disease in response to complaints that the word monkeypox has a racist connotation and stigmatizes patients. WHO says when the outbreak of monkeypox expanded earlier this year, racist and stigmatizing language online, in other settings, and in some communities was observed and reported to WHO. The international health body made the recommendation recently and says both names are to be used for a year until monkeypox is phased out. The new name, Mpox, is the result of months-long review process that included experts from around the world and input from the general public. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.